Hello, I'm David Kerr, Professor of Cancer Medicine from the University of Oxford. Today, I'd like to talk about oncology in the time of this coronavirus pandemic. I've just come back from clinic and found it very interesting. We've been, with some top-down pressure, I think appropriately, for us to reduce the number of outpatient appointments coming to our hospital, that sense of patients herding together, thinking about social distancing seems important. And what we did was, with the patients who had to come for chemotherapy, obviously we saw in clinic face to face. Those who were new patients, whom I still like physically examining patients regardless of CT scans and so on, we wanted to see those face to face. But maybe half to almost two-thirds of our patients were on follow-up, long-term follow-up, or they were on follow-up and due chemotherapy next week, that sort of thing. So it was an in-between chemotherapy check. So I sat in the clinic in a quiet room and phoned about 20 of our patients. We'd warned them that we'd be doing this. We teed them up for it. Some of them were getting the results of CT scans, so we'd explained that we would be breaking news, the remote possibility, bad news, if the scan had shown tumour recurrence. But all of the patients agreed and were very keen to accept our offer of a telephone conversation. It worked incredibly well. We had a timetable. Patients were expecting me to call them at such and such a time. That all worked perfectly. Everybody was there. And the conversation flowed quickly, effectively, and clearly. Now, I didn't have to break any bad news. That's absolutely, certainly the case. But it's really interesting that I guess I've been a doctor since 1980. Goodness gracious me. You would tell from my potato head that I'm that old. But nevertheless, I do things in the way that my colleagues from 19th century medicine would do them in terms of follow-up and so on. And I haven't ever really challenged it. I mean, I know that we're embracing the digital age, modern technology. We just had a fantastic publication in The Lancet about our work using digital pathology and artificial intelligence to come up with a brilliant new prognostic marker for colorectal cancer. So I'm doing all that stuff, I promise. But it was rather revelatory, and that sounds a ridiculous thing to say, that we could hugely reduce the amount of footfall through our outpatient department just with thoughtful, planned telephone conversation, not even a video link, and doing things that way. So that was one thing. And so I think this coronavirus thing will change forever the way that people, certainly oldsters like me, practice medicine. So that's one good thing. The second thing I think is more complicated. I often talk in these videos about us being part of a global community, that the cancer community is like a village in which we share data, information, in which we work together, those from the north, the south, the east, the west, and so on. The coronavirus outbreak, I think, is challenging that model of transnational cooperation. I don't know if you feel it, and I know that many of my colleagues in Europe are beleaguered. I have many friends in Wuhan, and the extraordinary steps the Chinese government, extraordinary steps that the Chinese government took to control it. For example, they moved tens of thousands of doctors into Hubei province. I had friends who work in Huaxi Hospital in Sichuan who were moved into the city of Wuhan to help deal with the crisis. So an extraordinary public health effort from China on behalf of our own citizens, first and foremost, but genuine, I think, on behalf of the rest of the world. In the United Kingdom, we're in the early stages of the epidemic, but we're starting to enter the foothills of the exponential phase. But what it seems to me is that governmentally, each of us are doing our own thing. We haven't shut down schools. We haven't as yet, but soon will ban large public meetings, sporting events and things like that have been self-cancelling. But it seems to me that the world is at its best when we come together, when governments, whether under the form of the G20 or UN, share data, share a concerted approach. This feels more like every country for themselves, closing barriers, looking inwards, slowing down. Now, the scientific community hasn't done that. We're incredibly grateful to Chinese colleagues who sequence, publish the genetic sequence of coronavirus as soon as they had it. No secrecy, everything was put out there to aid the global effort to find vaccines and so on. But the last time I remember us coming together was the fiscal disaster, the Great Fall of 2008, and governments genuinely did work together then. There's no doubt that the coronavirus will have an enormous effect on the global economy. But even there, I don't see any sense of governments coming together asking how they might handle and push this together. Instead, we have barriers being raised rather than lowered. And I don't think we can say it's necessarily the rise of populism, but it may well be that if government's first duty is to protect citizens, it may well be that when these pandemics occur, when panic sets in, the first thought is to put barriers up rather than to think, how can we work together? An observation only. I'd be very interested in what you thought, of course, and to post any comments that you had online. But for the time being, Medscapers, thanks for listening as always. Over and out. Thank you.